Hi everybody, welcome to the Health How-To channel. Today we're going to go over how to sleep without pain by avoiding certain sleeping positions. We'll also go over how to tweak your preferred sleep position to help you fall asleep more comfortably. Make sure you watch until the end where we talk about a 5-minute posture trick to add to your morning routine for a pain-free day. Are you having a terrible time sleeping because you either can't find a comfortable position to fall asleep, or you keep waking up because you're in pain? One of the key factors to sleeping without pain is to get our body alignment correct. Ideally, we want a spine that is mostly straight. It feels best when we support our natural curves. Ultimately, we want to avoid extreme bending or twisting of our spine while we sleep. Extreme bending or twisting can lead to neck, shoulder, back, hip, or knee pain. As children, we are generally the most flexible we will ever be, so kids can usually get away with sleeping in any position. As we get older though, our spine, muscles, and joints lose some flexibility, so we can find it more difficult tolerating certain positions for long periods of time. Sometimes we wake up stiff and achy and have trouble straightening ourselves up. This stiffness is due to fluid changes in our discs between the bones of our spine and hip and knee joints when we're not in a weight-bearing position. So now let's get to the best health tips for sleeping. What positions should you avoid if you have pain? Here are 8 health tips to get the best sleep possible. Sleep tip number 1, avoid lying on your stomach if you have back pain or neck pain. Sleeping on your stomach is generally the worst position for maintaining a neutral spine. When you lie on your stomach, your head is turned to the side so you can breathe, and your arms tend to go up over your head. This can lead to neck spasms, stiff shoulder muscles, or headaches when you wake up the next morning. Sleeping with your arms raised can also lead to numb hands or shoulder pinching and pain. As well, sleeping on your stomach can put increased pressure on your low back. This position can also restrict your ribcage from expanding and cause breathing issues. But what if you just can't sleep in any other position? Sleep tip number 2. If you just can't sleep in any other position than on your stomach, here's what to do. Put a small pillow under your chest so that your neck doesn't have to turn all the way, and you can tuck your arms under the pillow. Women may find a pillow under the stomach to be more comfortable. However, in the morning, get into the posture reset position that is described at the end of this video. Sleep tip number 3. Avoid sleeping on your side if you have shoulder or hip pain. The most common preferred sleep position is in the fetal or side-lying position. However, your bottom shoulder can get jammed forward under your body weight, causing a pinched rotator cuff and inflamed tendons over time. Your top shoulder can be bothered by a hunched forward position that throws your optimal body alignment out of whack. In addition, a mattress that is too firm or too soft can apply excessive pressure on your hip and trigger hip bursitis and hip pain. Instead, try to sleep on your back with a pillow under the knees to help minimize hip pain. If your shoulders still hurt when you lie on your back, tuck a pillow behind the painful shoulder. Although that position will still put the shoulder in a forward position, at least you won't have the added body weight compressing on the shoulder joint. But what if you just can't sleep in any other position? Sleep tip number 4. Create a channel for your shoulder by placing one pillow under your neck and one under your torso. This puts less pressure on the shoulder. If you really want to ensure that your shoulder pain doesn't get worse through the night, place another pillow behind your back, along the spine, and lean back slightly on it. This way you're not directly lying on your shoulder and you're not hunched forward. If you have hip pain, try putting a small pillow or soft rolled towel under the waist, especially if you have an hourglass figure. Add another pillow under the knees. This stops the knees from angling downwards and putting more pressure on the hip. If you find it hard to keep all these pillows in place, try buying a giant C-shaped body pillow. Incidentally, sleeping on your left side may help reduce gastric acid reflux issues, and sleeping on your right side may help those with heart issues. Sleep tip number 5. Avoid sleeping on your back if you have low back pain that stems from having an excessively arched lower back. Often people with a highly arched lower back can find that they just can't get comfortable on a flat surface. In this case, try sleeping in the sideline position with a pillow between the knees. But what if you just can't sleep in any other position? Sleep tip number 6. Place 1 or 2 very large pillows under the knees and maybe even a smaller pillow under your back for more support. Sleeping on your back is actually a fantastic position because in addition to being better for your shoulders and neck, it helps to decrease heartburn, puts less pressure on your internal organs, and potentially could help slow down skin wrinkling. The downside is that sleeping on your back can lead to increased snoring and sleep apnea. Sleep tip number 7. First thing in the morning, do the 5-minute posture reset. Set your alarm clock for 5 minutes before you actually have to get out of bed. Get yourself out of that comfy fetal position and flip yourself onto your back. Tuck a mid-sized pillow under your mid-back between the shoulder blades. Rest your hands, palms up by your side, and open up your chest. Take 20 nice deep breaths so that you have a great start to your morning routine and set yourself up for good body alignment and posture for the rest of the day. Here's one more bonus health tip. Sleep tip number 8. The actual best sleeping position involves flipping between all 3 positions where you change from your side to the other side to your back, maybe even on your stomach every few hours. We instinctively know that sitting in a comfy padded recliner for a solid 8 hours is not good for our body, no matter how comfortable it feels. The same idea is true for sleeping with 5 pillows holding in the same position all night long. People who are bedridden have to be turned every few hours to prevent excruciating bed sores. That's when there is skin and tissue breakdown from the constant pressure of lying in the same position. So actually, the discomfort that you feel is simply your body telling you that it's time to change positions. And ultimately, it means that you can relax. Don't worry about sticking to one perfect sleep position all night long. Subscribe and turn on notifications so that you don't miss any videos of life hacks to improve your health. Please leave any great sleep tips you have in the comments section below, or share this with someone you care about who also has trouble sleeping. Thanks for watching, and I'll see you in the next video.